If you don't follow politics daily, it can be hard to make sense of what our two major parties are up to. There's an awful lot of political cross-dressing going on. The Tories are raising taxes to pay for social care. On the other hand, this week, Labour voted against an extra £36 billion of funding for the NHS, which they created. Maybe there's an explanation. Let's see. Joining me now is the Shadow Health Secretary, Jonathan Ashworth. Before we get into that, John Ashworth, we see this morning that your leader plans to publish a 14,000-word essay which will tell us who he is, what he's about and what Labour wants. Wouldn't it be just simpler just to say we're for higher taxes or we are for a different way of organising health service rather than giving us a lot of philosophy?
Well, leaders publish essays about their core beliefs all the time. It's not unusual for a political leader to write an essay for a think tank which is associated with their party. I think the broader point here is, and I want to put this in the broader context, is that, look, I don't accept the premise of your opening remarks. I don't accept that a government imposing a punishing unfair tax rise on working people who are they also clobbering with council tax rises, with freezing their personal allowance, and a lot of them will lose £20 a week in the universal credit, is somehow a left-wing government. And actually, the vote in Parliament last week and the vote in Parliament coming up this week is whether we support that tax rise. It's not a vote on the funding allocations for the National Health Service. Of course, the Labour Party is always going to want to see more money going into the health service. But our problem with what has been announced this week is that it is a punishing unfair tax rise that won't deliver the healthcare that is needed. We won't see people treated within 18 weeks again like they were under the last Labour government. And it certainly doesn't fix social care. The cap, yes, it limits the liabilities that some people will pay out, but only benefits 1 in 7 people. What about the other 6 in 7 who see no benefit? You'll still have to pay top-up charges and fees, so you're still at risk of losing your house, so it fails on its own terms. In the small print, it suggests that because of the way the financing works, council tax will go up, or care homes will go bust, and there will still be thousands upon thousands of people in this country who don't get access to the social care they need. So I'm afraid I gently and politely disagree with the way in which you frame this.
OK, I've allowed you to explain at length why you think the government's wrong, and I hope that we've dealt with that point now, because I really want to talk about what Labour actually thinks about some practical things, as well as some broader political questions. First of all, are you going to go along with the government's likely decision to end the need for PCR tests after travel, if that's what they decide to do? So the Health Secretary seemed to suggest earlier on.
Well, we'll have to see what the proposal is when it comes before Parliament. We've had some briefing into the newspapers today that certain elements of the Coronavirus Act will be taken off the statute book. At first sight, based on the briefing, the clauses which are going to be taken off the statute book, that looks like a reasonable approach to me, but obviously we'll want to study the detail when it comes to Parliament, because there have been huge concerns about the way in which the Coronavirus Act has been misused by the authorities, and ridiculous fines have been imposed on people when they've been, sitting on park benches and so on. That's not what this legislation was aimed at. But obviously we'll want to study the detail. We can't just go off what has been briefed into Sunday newspapers, because we'll want to take a considered choice in the round.
All right, well, you're open to it. OK, let's talk about what Labour would do in relation to social care. And you've said already, we don't need to go back over the Tory proposals and all of that. Andy Burnham, your Labour colleague, wrote in the newspaper this week, "My advice to my party would be not to leave it too long before presenting a better proposal. Criticism of the Tory plan alone won't cut through unless we say what we would do." And he proposes what he calls Labour's opportunity to end this injustice, which is creation of a national care service, ask all older people to contribute whether they need care or not, and what he has also said is that we might take, a Labour government should take a chunk of someone's property if necessary. Are you up for all that?
Well, let me tell you what our alternative approach is to social care. First of all, we need to expand access to care, and we need to expand eligibility for accessing that care, so we can deliver the tailored, personalised care for people in their home, so they can stay in their home longer and not be forced into a home. At the moment, 3,000 people a day are turned down for care. You'll have people watching the programme this morning, Trevor, whose parents perhaps have got dementia, and they are battling with a complex system day in, day out, just to get some basic care for their parents, and they get turned down.
I don't want to be rude, Jonathan Ashworth. I don't want to be rude, but what you're telling me is what's wrong and what you wouldn't do. I've put to you what Andy Burnham has proposed, and I really just would like you to say, I think that's a good idea, or I don't know, or I think it's a bad idea.
No. Well, I am telling you what our care service will look like. Because with respect...
But how are you going to provide it? Which is what Burnham and I saw John McDonnell wrote about this yesterday. How are you going to get from here to there?
Well, if you stop interrupting me, I will tell you.
Well, if you tell me, then I'll stop interrupting you.
OK, well, you've just interrupted me again, Trevor. So, if you expand eligibility with a national framework for expanding eligibility, which is what we want to see, more people will access care in their home and will not need to go into a care home or or be delayed in hospital in a bed and not able to get care out in the community. If you do that, you actually save money. The IPPR, for example, has suggested you could save £2.5 billion. So there's a £2.5 billion saving that we will reallocate to the front line of social care. Secondly, you need to raise standards and quality in care. There's 15% of care services are rated inadequate. The way in which you raise standards and move away from these dehumanising 15-minute visits where you have to make a choice between having a warm bath or having a warm meal, or you're put to bed early evening, not because you want to, but because the system tells you have to go to bed. We want to end all that by investing in staff. So what we'll do is we'll pay the staff a real living wage. Lots of the staff get less than the minimum wage at the moment. We'll get rid of these 0 hours contracts that a quarter of the staff are on, and we'll invest in their training. Thirdly, there's a number of carers in this country who get no support whatsoever. We'll give them proper respite support. And fourthly, we'll have a plan for adults with disabilities, particularly adults with learning disabilities and autism, who are currently today, around 2,000 of them, locked up in hospitals, sometimes in the most inhumane conditions, like something out of a Victorian asylum. We are going to end that as well.
May I ask you a question now, please? So there is a different set of proposals
on social care. Of course.
May I ask you a question now, please? You've now given me a 4-point programme, part of which is to raise, you think, £2.5 billion. The Tories' plan this week is raising £12 billion. Where's your £9.5 billion coming from?
You know, I'm telling you, because we've got a reform programme, we can release savings. But there are other ways we can release savings.
£9.5 billion?
Every one of those adults in an inpatient care unit with autism or learning disabilities costs in the region of £200,000. If we looked after those people in the community, it wouldn't be costing £200,000 per person. You're looking in the region of £30,000. There's a saving. Secondly, the way in which we fund social care in this country is now through 7 different funding streams, and it is delivered through different mechanisms: Better Care Fund, Continuing Healthcare. By bringing health and care more closely aligned together, so the NHS and local authorities are planning care in local areas, you sweep away bureaucracy and you can deliver more care. And that's really important, particularly for people with dementia who are currently bounced around the system and don't get the care that they need. So by reforming care, you can actually release money to the front line.
Jonathan Ashworth, thank you very much indeed.